Muscle tension dysphonia. What is it? What are the causes and how can you tell if you have muscle tension dysphonia? That is exactly what I am going to talk about in this video. Keep on watching and I will be right back. Hi, I am Katarina, speech-language pathologist from How to Improve Singing, and here on this channel I share practical tips about using your voice in a healthy way. So if this is a topic that interests you, consider subscribing to this channel and hitting that bell notification icon so that you don't miss any of my videos. Muscle tension dysphonia, or MTD for short. You may know MTD under other names such as hyperfunctional voice disorder, spastic dysphonia or functional dysphonia, or even muscle misuse or abuse disorder. So, what is muscle tension dysphonia? It is a voice disorder in the absence of other structural or neurological disorders, which simply means that there are no other findings or abnormalities of vocal folds. For example, there are no vocal nodules. When there are no other structural changes present, we talk about primary MTD. But, as usual with our bodies and health, it's never straightforward. People can develop muscle tension dysphonia as a result of having vocal fold abnormalities, and we would recognize this as a secondary MTD. So you can have muscle tension dysphonia and vocal nodules at the same time. In this case, muscle tension develops as a compensatory strategy. Anyway, as the name suggests, muscle tension dysphonia, there is some muscle tension present in the vocal mechanism. You may be surprised to know that according to current understanding of this disorder, this tension may be located not only in the laryngeal area, but also in the chest, abdominal areas, or several areas at the same time. MTD is quite a common voice problem. Very often, more than 50% of voice clinic clients suffer from this condition. In spite of that, we really don't quite understand the causes of MTD. The good news is that voice professionals agree at least on something. There are many causes of MTD and they include psychological factors as well as physiological factors. So, for example, stress, anxiety, significant emotional trauma, acid reflux, glottal insufficiency, that's when your vocal folds don't close properly, also viral infections, muscular discoordination, allergies, environmental irritants, or increased vocal demand. By the way, if you want to know if you are misusing your vocal instrument, you can click here and download a checklist with abusive vocal behaviors to help you recognize them and avoid them. Here are some common complaints of people with MTD. Vocal fatigue is a common complaint. As the day progresses, the fatigue worsens and people with MTD may have difficulty using their voice at the end of the day. If you want to learn more about vocal fatigue and how to deal with it, you can watch my other video on this topic. Another symptom is pain when speaking. This pain can be felt even when not talking or can worsen with swallowing. Some people may even think that they have a problem with swallowing, not MTD. This pain can be often felt just on one side and it can be felt around the ear. And again, some people may think that they have an ear problem, not MTD. Another symptom is hoarseness. And it's a very common complaint. Reduced vocal range or inability to sing in either high or low ranges. A feeling of a lump in the throat, so-called globus sensation, a feeling that something is stuck in the throat. And also shortness of breath when speaking is quite a common complaint. The symptoms of MTD can be really varied, and every person with MTD sounds differently. Their voice can have various degrees of hoarseness, from mild to very severe hoarseness. They may be speaking at an unusual pitch, which means that their voice may sound too low or too high for their age and gender. Their voice can be inconsistent throughout the day, or even inconsistent throughout the sentence, and can go in and out. It may be very breathy or not breathy at all. It may be impossible to increase the volume or sing with good dynamics. The voice may sound weak, constricted, harsh, tense, or croaky. It may even feel like speaking or singing takes a lot of effort, or it can be very painful to talk or swallow, or there may be no pain at all. And some people with severe MTD may not be able to use their voice at all. It is also interesting to know that some people with MTD have different breathing patterns than people without this disorder. When a healthy person speaks, he or she starts speaking at about 60% of their lung capacity and takes another breath at about 40%. However, some people with MTD usually start talking at 40% of their lung capacity and talk down to 10% of their lung volume, so they basically talk towards the end of the breathing cycle. And you can only imagine that this requires a lot of muscle work, especially the work of the expiratory muscles. Also, with this extra muscle work, a person with MTD may not have enough airflow for speaking or singing. Another sign of MTD that is quite common is a high laryngeal position. This is caused by tension in the superficial neck muscles that move the larynx upward. These would be the muscles that are above the hyoid bone or above the thyroid cartilage. You may either see tension in that area, the area under the chin and base of the tongue, or it may feel very hard and painful right here. Some people with MTD may have a habitual forward head position, which of course impacts voice production and breathing too. So as you can see, the symptoms and signs are really wide-ranging. So how do you know if you have MTD? There are three important components in the process of making the diagnosis of MTD. Symptoms, which I just described, cannot be the only measure to determine if you have or have not muscle tension dysphonia. So don't try to self-diagnose based on these signs and symptoms. This diagnosis requires a team of voice professionals, including a physician, speech-language pathologist, and potentially other medical professionals. Number one, the first component is very detailed history of the voice problem. Knowing how voice difficulties started and how they developed or changed over time may be an important indicator for this diagnosis. Number two, perceptual voice evaluation, meaning how your voice sounds, palpation, so touching, to assess muscular tension, and careful observation of the whole body by a speech-language pathologist is another important part of the diagnostic process. And number three, finally, laryngoscopy, and more specifically video stroboscopy, is absolutely crucial in confirming the diagnosis of MTD. A laryngologist has to see and evaluate the structures and functions of the vocal folds and other laryngeal structures. Other tests and examinations may be also necessary to map the whole picture. Making the diagnosis of MTD is not easy, and it may take some time. If you experience voice changes or hoarseness for more than 2 weeks without the presence of an acute infection, speak to your doctor and see a specialist. The sooner, the better. In the comments below, let me know if you have been suffering from muscle tension dysphonia. Now, once you have the diagnosis of MTD, what do you do? How do you treat MTD? I will be answering these questions in my next video. So don't go away and check out my other videos right here below. I will see you soon.